Hi everyone, good afternoon. Thank you so much for joining today's webinar. We'll be talking about new Psyches feature highlights in 2025. My name is Michelle Ram. I am a research scientist on the medical informatics team within the Office of Population Health and Evaluation, and I will be taking us through today's training. So our agenda includes a brief Psyches overview. So we'll look at what reports are in Psyches, what data is included, who is included in Psyches, etc. And then we'll be going into the meat of our webinar. So we'll be talking about all new things that were added into Psyches in 2025. So this includes new filters like complex needs and intensive mobile treatment. We've recently added an update to our Health Home Plus eligibility criteria. We've also added some new columns to our current outpatient provider advanced view. We've added a few new service settings to Psyches that I'll be going over today. I'll also show a more recent update in my QI report where we've separated out our indicator set tabs. And then we'll touch on the new hospital outcome measure set and then our updated readmission measure sets as well. And then we'll make sure to end with training and technical support. And also at the end, I'll stop for any and all questions that come in during today's training. And I want to just remind folks that we will be recording today's training and we'll be sending out the slides along with the recording link shortly after the training is over, and then they'll also be posted to our website shortly. All right, so we'll dive right into our Psyches overview. What is Psyches? Psyches is a secure web-based application that integrates a few different data sources into one application to support population health, quality improvement, care coordination, and clinical decision making. So we have a lot of different data sources that are feeding into Psyches, over 10 different health-related data sources. And one of our biggest ones is Medicaid billing. But among others, we also have other state administrative data sources like EMR data coming from state PCs. We have New York City data, which includes information from Rikers, Department of Homeless Service data, and DOHMH data. We also have our state OMH databases that include information on AOT, NYMERS information on suicide incidents. We have CARES information for living and residential support treatment. And then we have provider and recipient entered data. So that includes information entered like psychiatric advance directives or safety plans, or if folks enter in other documentation like relapse prevention plans or discharge plans, those can be attached to an individual's clinical summary. And they can also enter in rating scales. So we have the CSSRS suicide screening, and then the PHQ-9 depression screening as well in the application. Right now, we have over 12 million individuals that are viewable in Psyches, and this includes individuals with any history of a Medicaid-funded behavioral health diagnosis or treatment, or those who've had state PC inpatient or outpatient services, or folks who have had health home outreach or enrollment. Those individuals will be included in the Psyches application. All right, we have a few different reports I'm going to go over. We have our individual client level reports, so that includes the clinical summary, and that takes all of that data coming in from Medicaid billing and our state databases and puts it into a compact view to review their treatment history. And this is up to 5 years worth of data. And then we have our provider level reports. So we'll be touching on a few of these today. We have my QI report, which goes over your current performance or prevalence rate on all of our quality indicators. You can drill into a quality indicator and review the names of any clients that are flagged for that particular indicator. You can also filter this report by managed care plan, by service setting, or even by population or age. Then we have recipient search. We'll be touching on that a lot today. That's where a few of our new features were added. So here you can run ad hoc reports to identify any cohorts of interest. And we also have our advanced views on the recipient search results page. And I'm going to show you how to apply an advanced view to your results, particularly the outpatient advanced view we'll be going over today. And then we have our usage reports. So those are used to monitor protected health information accessed by staff, like seeing who's accessed clinical summaries. Our utilization reports help to support provider value-based payment data needs. And then we have our statewide reports. So here you can select a quality indicator and review the statewide proportions by population, like complex needs, by provider or client residence, region or county, or by managed care plan or network or provider, and so on. All right, who uses PSYCKES? We have a few different buckets of individuals that use the application. We have recipients and families who can access their own clinical summary information through My Choice. They can access their treatment summary, which is the recipient-facing version of PSYCKES. We have thousands of recovery-oriented resources included in Pat Deegan's recovery library. And here they can also report and track their patient-reported outcomes. Then we have clinicians, provider agencies, and networks. I think those might be the biggest bucket of our users. And they can view their performance for quality indicators relative to the region and statewide prevalence rates. You can also conduct searches for group cohorts of interest on your patient population. And with consent or emergency access, you can view a client's clinical summary as well. Then we have managed care plans who can view their members' data, and state and local government can view aggregate data or identify data as needed in PSYCKES. All right, how can PSYCKES be utilized? There's a few different ways PSYCKES can be utilized, and it's not just limited to this list. But here's a few of the ways we thought PSYCKES can be utilized, especially in clinical work. So that includes inpatient, emergency, or outpatient clinical work, shared decision making with the client and staff, and patient engagement. Again, folks can create and store safety plans or psychiatric advance directives in the application. PSYCKES can be used for incident review or care coordination or creating provider networks. It can also be used to identify those at-risk populations to help support intervention. It can be used to monitor new program implementation or used for budget initiatives or quality improvement initiatives as well on some of the quality improvement projects going on. And then, of course, it can be used for population health overview. So that's a very brief overview of what PSYCKES is. Now we're going to go into the fun stuff, the new features that were added to PSYCKES in 2025. So I'm going to start with complex needs. And this complex needs flag was created to help assist providers in identifying those individuals who have that higher level of service need prior to discharge due to any of the complex needs reasons we've identified. So this has been added to a few different areas of the application in PSYCKES. We have complex needs in recipient search. So it's its own filter bucket in recipient search. And here you can select a search for individuals with any of the complex needs criteria, or you can select specific complex needs criteria to run a search for. And it's also in My QI report and statewide reports. So we've recently added complex needs as its own population filter. And then the client level clinical summary. In the notifications section, if somebody meets any of that complex needs criteria, you'll see that their complex needs due to, and then it'll list out all of the complex needs criteria that that person meets. And I'll show examples of all of these. All right, so there's a long list of what constitutes complex needs. So this is the list of the complex needs criteria. I'm not going to go through each one of these, but we wanted to include this slide so you can review and have it for reference in the future. These are also included in recipient search, all of these complex needs criteria that you can select from. So we have the general criteria and then additional criteria for children and adolescents. So here's what this looks like in recipient search. We've gone to the purple navigation bar at the top of the screen in PSYCKES, clicked on recipient search, and then we went down to the special population section. And in that special population section, we have a complex needs filter, which I've opened up here. And I've selected in this example searching for folks who have any complex needs criteria. So that'll search for individuals who have any of the criteria listed below. You can also check off up to 4 options in this complex needs filter box as well. It's a multi-select feature. Now we've moved to My QI report. And here, if you click on the blue filter button over on the right-hand side of the screen, this filter box will pop up. And we've added a new population option here. You can see originally we have all, which looks at all of the population included in your report, or specifically folks that meet any of the complex needs criteria. So you can stratify your report just for those complex needs individuals. And then the clinical summary. So here we have a screenshot of the brief overview. It's been scrambled and de-identified just for this training purpose, but you'd see an individual's general information, their current care coordination information, and specifically what I want to point out in the notification section is that complex needs due to notification. So if a client meets any of the complex needs criteria, this notification will appear and that specific criteria that they meet will be listed as well in this message. All right, so again, I'll make sure to stop for questions at the end. I'm sure we'll have plenty of time for questions, so I'm going to move right along to intensive mobile treatment IMT filter. So this new intensive mobile treatment past year filter was recently added to recipient search in the high need population filter dropdown. And we've added this in here because previously you could see IMT services in an individual's clinical summary, but you didn't have the ability to perform those group cohort searches for individuals that you're serving that have received IMT services with any provider in the past year. So maybe your agency doesn't have IMT services available. You can still use this filter to see who you're serving that have received those IMT services from any provider in New York State in the past year. Now this filter is updated on a weekly basis. And again, you can find IMT service information in a client's clinical summary within the current care coordination section and the behavioral health services section when applicable to that client. So again, I'm going to show what this looks like in the application. We're back in recipient search. We're back in the special population section. And here we've opened up the high need population filter dropdown. And you can see I've highlighted the new IMT past year filter. So you can run a group cohort search using this filter, and you can add on other filters as needed. And then this is what it looks like in the clinical summary. So we've drilled into someone's clinical summary and they've had in the current care section, you can see they've had IMT services. And you can see the provider name, the admission date, and the main contact information for IMT for that individual. And if you scroll down the page, you can see a little bit more information for these IMT services in the behavioral health services section. So here I can see that this person's received IMT. I can see the provider name again and the first and last dates billed and the number of visits. All right, so that covers the new IMT filter. So I'm going to move along to our recent update to Health Home Plus eligibility criteria. So we've added this new criteria to our Health Home Plus eligibility in PSYCKES to better align with the current Health Home Plus definition. So the new criteria that we've added is homelessness in the past 6 months and a DOH serious mental illness SMI diagnosis in the past year. So that's the new Health Home Plus eligibility criteria that we've added to PSYCKES. And it's been applied to a few different areas of the application. This new criteria has been added to the high need population filter dropdown as its own filter selection, and it's been rolled up under the Health Home Plus eligible filter that we currently have in PSYCKES. It's also been applied to My QI report and statewide reports. So in these two sections, we have some Health Home Plus eligible indicators available. in the Health Home Care Management Adult Indicator Set. And then we have one that exists within the Vital Signs Dashboard Adult Indicator Set as well. So this new homelessness criteria has been applied to those Health Home Plus eligible quality indicators. And then in the clinical summary, if someone is eligible for Health Home Plus, in the notification section, you'll see that they're eligible for Health Home Plus services, and then you can see the reasons why. So now that homelessness criteria will show in that reason why section when applicable to that client. All right, so just to show what this looks like again, recipient search, and again, we're in the special population section. So we've opened up the high need population filter dropdown, and you can see the first filter that's highlighted is our new Health Home Plus eligibility criteria, homeless in past 6 months with a DOH SMI in the past year. So you can search specifically for this Health Home Plus eligibility criteria, or you can search overall for who's Health Home Plus eligible for any of the other Health Home Plus eligibility reasons, like AOT or 3 or more inpatient mental health in the past 13 months. So this captures our original Health Home Plus eligibility criteria plus this new one we've recently added for homelessness. Just to show where else this new criteria has an impact, I've drilled into my QI report here. I'm logged in as an agency and I've drilled into my QI report. And in the quality improvement measure set bucket, I've drilled into the Health Home Care Management Adult Indicator set. And here is where our eligible for Health Home Plus quality indicators live. So now that we have that new criteria of homelessness added, you might see your numbers increase here since we're capturing an additional population now in these quality indicators. All right, and then the clinical summary, this is where you can see if somebody is eligible for Health Home Plus. You can see in the notification section in both the brief and full summary view, their Health Home Plus eligibility reasons. So this client is eligible for Health Home Plus due to, and then you can see our newest criteria that's been added. So that will show when applicable to the client among any other Health Home Plus eligibility criteria that they might meet. So that will show in the notification section of their clinical summary. All right, new columns added to the outpatient provider advanced view. So we have recently added some SUD information to our current outpatient provider advanced view. So we also call these the population management advanced views. And what this is when you run a recipient search, you land on our standard recipient search results page with the standard table, standard columns. And what you can do is you can go to the top right of that recipient search results screen, and there's a view drop down. And you can select from a few different advanced views that we have available in the application that add on columns to your standard recipient search results table. So I'll show what that looks like. But specifically this year, we've added new columns to our outpatient provider advanced view to display substance use outpatient provider information in the past year. So it'll show the most recent provider facility name, the most recent service, and then the number of services with that provider for substance use. And I do want to mention that substance use information is considered enhanced PHI, so you wouldn't be able to see information on clients for this type of service unless you had their signed consent or it was a clinical emergency and that was attested to in the application. All right, so I want to show what this looks like. So I've logged in as an agency, Main Street Agency. I went into recipient search and I ran a search to see who of my clients have received outpatient SU services at any provider in New York State in the past year. So you can see 774 recipients meet that criteria. So 774 clients that I've served have received an outpatient SU service from any provider in the state in the past year. Now, I want to point out, since this is a substance use service setting that I'm searching for, only 15 recipients are going to be visible on my search results page because I have their signed consent or clinical emergency access. So that's why I can see these scrambled names. I could drill into this information if I wanted to because I have their PSYCKES consent enabled in the application. So 15 are included and 759 recipients are excluded because I don't have their signed consent or emergency access. So that's just something to keep in mind when you run a search for something that's considered enhanced PHI like substance use. So on the top right, we have our view dropdown, and there's a little eye icon next to the word view. And if you tap on that little eye icon, a pop-up appears showing you our different advanced views. So we have care coordination, high need, high risk, hospital utilization, and outpatient providers. And on the right-hand side, you can see what columns will be displayed with that particular advanced view. So a bunch of different columns can get added depending on the selection that you make. So right now we're just going to focus on outpatient providers because that's the one we've updated recently. So I'm going to select the outpatient providers advanced view. So now you can see I have my standard recipient search results columns here, and more columns have been added to the right of my screen. And now I have the ability to scroll. So I can see primary care physician, PCP assignment in the past year by the managed care plan. So for individuals that this applies to, you can see their primary care physician name, the most recent service, and then the number of visits with that assigned PCP. Then if you scroll over to the right, you can view more information like mental health outpatient providers in the past year or medical outpatient providers in the past year. But what I want to highlight here is the substance use outpatient provider past year column. So this is the newest column we've added. So here you can see the most recent provider facility name for substance use, the most recent service date, and then the number of services with that provider. Again, we can only see this information for substance use for consented or emergency attested individuals in the application. So if you keep scrolling, I just want to point out what is left in this advanced view. We have the core or adult HCBS service provider in the past year. So the outpatient provider advanced view captures a lot of different outpatient information. So what you can do with this report is either drill into a clinical summary or export to Excel on the top right of the screen. Okay, that covers the outpatient advanced view. Um, Actually, since we have so much time, I wanted to just check in with Melanie. Is there any questions that came in yet that I could help with before we move on to the service settings?
Michelle, we currently have no questions.
Okay. Thanks, Melanie. Feel free to write in your questions into the Q&A box. I'll make sure to definitely stop again at the end of the webinar. So we'll go right ahead into the service settings that we've added this year. There's been quite a few that we added in 2025 to recipient search, my QI report, statewide reports, and the client level clinical summary. So we've added ACT, which we did already have ACT mental health specialty, but we divided it up now into certain categories like adult, adult youth, or just youth. So we've split up the ACT service settings. We also have added crisis stabilization center, intensive and supportive service settings. We added clinic SU comprehensive outpatient treatment, and then ER mental health CPEP extended observation bed EOB service settings. Again, I just want to note here that clinic SU comprehensive outpatient treatment service setting is enhanced PHI. So if you run a search for that, you're going to see that 3 count I just showed recently, and you'll only see the names of individuals that have signed consent or emergency attestation. Okay, so I'll show where all of these exist in recipient search. So if you log in as a provider and you offer these specific types of services, you can see these services in the services by specific provider section. But what I've done is I've gone to the services by any provider section so you can see if individuals you're serving have received these services at any other provider in New York State. So we have the ACT services that have been divided into adult and youth, and that's located under the care coordination bucket. So if you tap on that little minus sign, that'll expand that category and show the ACT services. Sorry, I had a little coughing fit over here. Okay, so crisis services. We have expanded the crisis service settings. I'm sorry, 1 second. Okay, I'm sorry, I'm getting over a cold, so excuse me for that. All right, so we've expanded the crisis service settings. And here we have the Crisis Stabilization Center, intensive and supportive service settings that exist. Moving on, we have under outpatient SU, you can select that new clinic SU comprehensive outpatient treatment service setting. Again, that's enhanced PHI, just as a reminder. And then under inpatient ER, we have the ER MHCPEP extended observation bed service setting under the inpatient ER category. Okay, in my QI report, we also, in the filter option, if you select that filter button, you'll see that filter box pop up. And in the program type drop down, we have all of those new service settings that exist. So again, ACT, Clinic SU, Crisis, and ER EOB. Okay, statewide reports, very similar to my QI report. If you select an indicator set and indicator type, in the program type dropdown, that's where you'll find those new service settings that we've added, so you can apply those to your statewide report search. And then in the clinical summary, right now we're on the brief overview page. So I've drilled into a client's clinical summary. I have consent for them or emergency access, so I'm able to drill in. And all of their information's been scrambled just for the training again. But you can see I'm on the brief overview screen. So if I scroll down on the brief overview page, at the bottom we have the outpatient providers past year section, and that's where you'll find the ACT services like ACT Adult or ACT Youth, or the Clinic SU Comprehensive Outpatient Treatment Service setting. If applicable to the client and you have signed consent or emergency access, this service setting will show in the outpatient providers past year section. And then to the right, the all hospital and crisis utilization section, we have our crisis services bucket down here. And if anyone's had a crisis stabilization center intensive or supportive service, those service settings will show in this section of the brief overview. And then I want to show what it looks like in the full summary view, because you do get a little bit more information. So we have in the full summary view, the care coordination section, and here's where you'll see ACT information. So ACT Adult or ACT Youth will show in the care coordination historical section or the current care coordination section as well. We have behavioral health services section. So here you can see if somebody's had ACT services, and you can see a little bit more detail here. So you can see the provider name, the first date billed and the last date billed, the number of services, the most recent primary diagnosis, which you don't get up here in the care coordination section, and the most recent procedure for ACT information. And then in the behavioral health services section, you also can see the Clinic SU comprehensive outpatient treatment service setting. Again, with the provider name, the bill dates, the number of visits, the most recent primary diagnosis, and the most recent procedures for that service. I'm sorry about my voice. I hope it sounds okay. Hope everyone can hear me well. All right, and then moving on to the crisis services section in the full summary view, this is where you can see the Crisis Stabilization Center intensive and supportive services. So if someone's had either of these services, you'll be able to see the provider name, the admission and discharge dates, and the number of visits or their length of stay, their most recent primary diagnosis associated with that service, and their most recent procedure. And then last but not least, in the hospital ER section, we have the ER MHC PEP EOB extended observation bed service setting. Similarly to above, you can see the provider name for that EOB service, the admission and discharge date and length of stay, their most recent primary diagnosis, and then their most recent procedures. Okay, so next we are gonna just touch on a separation of indicator set tabs that occurred in my QI report with our most recent refresh. So in my QI report, we've divided up the quality improvement and performance tracking indicator sets into two tabs. And the purpose of this was to really help users more easily identify between the different as of dates for the quality improvement measures and the performance tracking measures. So our quality improvement measures, those are our PSYCKES run measures. They're run on a monthly basis, and they're considered more real time. And then the performance tracking measures, those are run with an intentional lag of 6 or more months to help allow for complete data to display for those indicators. Now, I do want to note that right now in the application, the DOH performance tracking measures are currently as of December 1st, 2024, and that's due to a delay in these measures being updated by DOH. So we still are attributing clients monthly based on a 9-month look back period. However, those measures aren't being updated. They haven't been updated since December 1st, 2024, and we're hoping they'll be updated within the next couple of months. So there's a little bit more than a 6-month lag for the performance tracking measures, and that is why. Okay, on the QI report screen, I'm logged in as Main Street Hospital, and you can see up at the top we have our quality improvement tab. Again, these are more real time, and right now they're as of 8/1/2025. And then if you tab over to the performance tracking measure set, these are as of 12/1/2024. And again, these have an intentional lag of 6 or more months to allow for that complete data to come in. So just wanted to update everyone that these measure sets have been separated by tabs now in the application. Okay, we're flying. So the last new feature that I wanted to touch on today is the new hospital and readmission measure sets. So we've added a new hospital outcome measure set to my QI report and statewide reports this year. And this new hospital outcome measure set has 7 episode-based measures that are specifically attributed to the discharging hospital. We are calculating the numerator and denominator for these measures by discharge episodes, not by individuals. So I've included the list below showing what these new 7 episode-based measures are. And for the first few, no follow-up after mental health inpatient discharge from this hospital within 7 or 30 days, or no follow-up after mental health ED discharge from this hospital within 7 or 30 days. These are looking at if someone's had or if a discharge has had a follow-up mental health outpatient visit. So if that discharge doesn't have that follow-up mental health outpatient visit, then that person would be flagged, or that discharge would be flagged for that indicator. And then below that, we have no engagement after mental health inpatient discharge from this hospital. So this is looking at the percentage of discharges who did not receive 5 or more follow-up visits with a community-based mental health provider within 90 days after being discharged. And then the last two, no intensive care management after MHED or MH inpatient discharges from this hospital. This is looking at the percentage of discharges among individuals identified as having high mental health needs. So that includes folks who are Health Home Plus eligible, or who are enrolled in ACT, or receiving CTI, Critical Time Intervention Services, and they did not receive high intensity care management services in the month following discharge. So we're looking again at those high mental health need individuals who did not receive those high intensity care management services in the month following their discharge. Okay, so I'll show where this new hospital outcome measure set exists. We're in my QI report here. I'm logged in as a hospital. And in the performance tracking tab, I can see the hospital outcome measure set here. So let me drill into that and I'll go over each column. So here's an example, no follow-up after MHED discharge from this hospital within 30 days. So you can see the population included in that measure set, the eligible episodes, in this case, the number of ED discharges from this hospital, that's the denominator. And of those discharges, which ones did not have that mental health outpatient follow-up within 30 days? So there's 133 ED discharges for mental health from this hospital, and 54 of those did not have that mental health outpatient follow-up within 30 days. So we take the numerator over the denominator, and that gives us our prevalence rate for that measure. And right now, we can compare that to the regional and statewide prevalence rates. Ours is looking higher, so maybe this is a measure we want to focus on to work to improve. So if I drill into that measure set, I can go to the recipients tab, and here I can see individuals that are flagged for that measure. If I have consent or emergency access, I can drill into their clinical summary. I could enable access in my QI report, or I can export to PDF or Excel here. All right, and then we have our readmission measures, and what we've done this year is converted them from individual-based counts to episode-based counts in my QI report and statewide reports. So these measures for readmission post-discharge now capture each separate episode, meaning each separate inpatient discharge, to calculate the numerator and denominator. So we have two different buckets of readmission measures. We have readmission post-discharge from any hospital. So just as an example, you can select a measure by the certain type of cause you're interested in, like mental health, medical, behavioral health, or all cause. So just as an example, I'm going to point out this first measure here, readmission 30 days from any hospital, mental health to mental health. So this is looking at the percentage of mental health inpatient discharges that are readmitted within 30 days of discharge to any hospital's inpatient service for mental health reasons within the past 13 months. So that's just an example of how we're defining one of those measures. And if you ever are curious on a measure's definition, in the application you can hover over that measure. We also have some technical specifications on our website. You can always email us. And then throughout our application, we have an option to click on a measure and export the definitions as well for all of our quality indicators. Okay, so before we were looking at readmission post-discharge from any hospital, and now we're looking at readmission post-discharge from this hospital. So this might be more useful for our hospital users. And just an example of this, first one, readmission 30 days from this hospital, mental health to mental health. This measure is looking at the percentage of mental health inpatient discharges from this facility that are readmitted within 30 days of discharge to any hospital's inpatient service for mental health reasons in the past 13 months. So this is looking at this facility, whereas this is looking at any hospital. All right, so these readmission measures live in our quality improvement measure set bucket. So we're in my QI report. Again, I'm logged in as a Main Street Hospital. I'm in the quality improvement tab. And here are those two readmission measure sets. We have readmission post-discharge from any hospital and then readmission post-discharge from this hospital. And I have data here because I'm logged in as a hospital, so I can see who was discharged from my hospital I'm logged in as. Again, you can hover over these indicators. Just as an example, I've hovered over the any hospital measure set, but I'm going to drill in to readmission post-discharge from any hospital. Again, these are episode based. So just as an example, for this first one here, readmission 30 days from any hospital from mental health to mental health. So I can see the population that's included, The eligible episodes. So this is the denominator. And again, these are looking at the number of mental health inpatient discharges. So we have 1392 mental health inpatient discharges. And of those discharges, 215 have been readmitted within 30 days to any hospital's inpatient service for mental health reasons within the past 13 months. So these are the folks that have had that readmission, or the discharges that have had that readmission. And again, we can turn that into our prevalence rate. 15.4, we can see we're a little bit better than the regional percentage, but a little bit higher than the statewide percentage. So we want to see our prevalence rate go down over time. The lower, the better. So this might be something I want to work on to get this measure prevalence rate lower. So I'm going to drill into that indicator. And again, we land on the recipients tab. Here I can drill in if I have access, or I could enable access, or again, export to Excel or PDF. Okay, training and technical support. Those were our new features of 2025. So now I'm just going to touch on other resources that we have on our PSYCKES website, psyches.org. We have recordings and slides for our PSYCKES training webinars, and they're divided into certain sections like role-based features, like you're on now, access related, and then release overviews. We also have user guides, which go into each section of the PSYCKES application in great detail. So our updated user guides are available on our training materials page. And then lastly, we have our short how-to videos for things like the self-service console or how to review a client's clinical summary. And then technical support, we have our PSYCKES help desk available Monday through Friday at psyches-help@omh.ny.gov, and we're available for any PSYCKES application-related questions. And if you have a question about your token or issues logging in, that's where the ITS or OMH help desk might be most helpful, but we can always triage your inquiry to them. If you need support, you can always email us as well. But we have our ITS help desk, that's for state employees, OMH and state PC employees, and then the non-OMH and non-state PC employee help desk. You can contact them at the 474-5554 number, or the health help at its.ny.gov email address as well. So I'm just going to pause here and see, Melanie, if any questions came in during the training today.
We didn't have any questions, and we did hear you
Okay.
perfectly well, so no issues with sound.
Thank you. I don't know. Of course, I have a coughing fit right now, but I'm so glad. I mean, thank you. I hope that means everyone understood everything I went over. And of course, if you have any questions that come up afterwards, please feel free to contact us at PSYCKES Help. And I appreciate everyone's time today. I hope you all have a great rest of your day and take care. Thank you.